team at Children's Healthcare of Atlanta includes board-certified pediatric physiatrists and nurse practitioners whose specialty is addressing the acute physical and rehabilitation needs of pediatric patients. This team, led by a board-certified pediatric physiatrist, will be your child's primary care providers.
All of our physicians are board-trained in pediatric rehabilitation medicine, so we are all specialists in function. That really just means that we are focused on maximizing your child's independence in moving around and the things you have to do to get ready to go in the morning and take care of yourself.
Your care team also includes pediatric rehabilitation nurses, pediatric therapists, child life specialists, case managers, and many others who will guide your family through the rehabilitation process and the transition home.
We develop a relationship with you and your family and your child because you're here for a little more than just a few days. So we care about the family and we want to get that family unit back together to transition home.
Each day, your child's assigned care team will meet with you and your child.
When you arrive, the doctors, the nurses, everyone helping in therapy, the patience they have with the child, the one-on-one.
The ratio of nurses is 4-to-1, which is a low ratio for nursing. So we really tailgate that to getting their rehab needs met. And so 4-to-1 is a nice ratio so they can spend quality time with each patient and spend quality time educating the families, because our nursing staff, as well as our therapy staff, spend a huge deal of time educating families on their diagnosis and on treatment plans and on their prognosis. So it's not just the medical team that does that, it's our therapists and our nurses that do that as well.
In addition to daily visits from your care team, there will be education, training, and family conferences for you and other family members. Our team will work closely with you and your family so that your child's rehabilitation experience and transition home is as smooth as possible.
In the beginning, a lot of it is going to be some observation, but then quickly we do like our families to become hands-on, because the more that they are doing the care, the more they feel comfortable with taking their loved one home.
The most rewarding thing that I've seen is when we arrived, my son was in depression. I'm not going to walk. The whole staff's telling him, you need to do it because you are going to walk. The whole therapy team, the doctors, they're just wonderful and they help keep his spirit up.
Pediatric physiatrists are specially trained to diagnose, manage, and treat pediatric patients with acute and traumatic medical conditions affecting their functional abilities. They also treat injuries and diseases of the musculoskeletal and neuromuscular systems and pain.
They're teaching me still great information on how to live with it lifestyle-wise, not only him, but as a family.
A wide range of therapies and services are offered 7 days a week, including physical therapy, occupational therapy, speech therapy, and additional services such as school reentry, music and pet therapy, recreation therapy, pediatric psychology, and neuropsychology.
I really enjoy working as a team member. So we work with PT, speech, the medical team, OT, the nurses, dietitians, everyone's part of our daily life. And bringing the patient into the gym and incorporating our therapeutic methods with play is my favorite part.
Additionally, we offer technology-focused rehabilitation as part of our Inpatient Rehabilitation program and in the Center for Advanced Technology and Robotic Rehabilitation. We also offer aquatic therapy in our state-of-the-art hydrotherapy pool to help improve movement and function. Children's provides a full continuum of care, which means our team helps patients through their entire rehab journey at our facility, while also preparing patients and families for life outside of the inpatient rehabilitation unit.
One of the reasons why we do stay in Atlanta is because of children's. We don't have a support system here, so they're our extended family. So the support that we get from people here on this floor is a beautiful thing to have.
We offer kids and teens special services to help them return to their home, school, and community.
I serve as the liaison between the families and the schools. So when the patients come in, we get releases from the parents, and then we notify the schools about where they are, estimated length of stay. We set up hospital homebound so that their teachers can send assignments, and we can build school time into the kids' therapy schedules.
Many of our patients will transition to our day rehabilitation program for continued age-appropriate therapy and to prepare them to return to work or school. Across the continuum of care, we offer other specialized treatment options, such as referrals to vocational rehabilitation and counseling, driving skills evaluation and introduction to training, and adaptive sports. Patients may also participate in group therapy and peer support groups with other patients facing similar challenges and goals. This allows them to discuss common fears or issues about their injury or illness, while also supporting each other during their stay. In addition, we reconnect our patients and families with former patients of similar age and diagnosis, which gives our families a mentor to help throughout their rehab journey.
We have peer representatives who come to the hospital. They come in and talk to the patients separate from all of us, that it's more, they can really talk freely with them. These are the frustrations I'm having, these are the problems I'm having, this is what I'm nervous about. And they can talk real talk with them and let them know this is what it's going to be great, and this is what it's like, and let's go outside for a little bit, and what can I help you with?
We also offer patients and families the opportunity to go on outings to a number of locations in the community.
So we go to the mall, or we go to Walmart, or we go to the aquarium, or things that families might do once they leave here, just to show them, like, hey, not everything's very accessible, or hey, it may look a little bit different, you got to go to a different restroom, whatever it may be.
A recreational therapist, pediatric rehab nurse, and other members of the therapy team will participate in the outing. They will answer questions, provide assistance, and make sure families feel comfortable being out in the community before being discharged from the hospital. These outings allow patients and families the opportunity to practice all they have learned during rehab to prepare for returning home.
Rehab is not an in and out visit, and so you get to build that rapport with the families, you get to see the progress with the kids, you get to see that hope and that joy.
Children's Healthcare of Atlanta has one of the largest pediatric inpatient rehabilitation facilities in the country.
In an adult facility, it might possibly be a standalone facility, and we're part of Children's of a bigger network. So if we do need to call in a gastroenterologist, a neurologist, an endocrinologist, whatever, we have those physicians available and those specialties available to assist us.
Located on our Scottish Rite Hospital campus, the Inpatient Rehabilitation Program is for patients up to age 21 and is accredited by the Commission on Accreditation of Rehabilitation Facilities, which recognizes our spinal cord system of care, brain injury, and pediatric specialty programs.
I would choose Children's because we have the best that there is to offer. Our staff is committed and dedicated to taking care of children and their families, and we all love children, and that's why we are here.
We offer 28 private rooms designed with patients and their families in mind.
So toward the end of your stay on rehab, we have something we call a rooming in, where you go to the transitional living room and you pretend that you're at home, but we're here to support you if you need us. So it's just kind of like a trial run to see how it will be at home, and any obstacles or any things that you may run into. We're here to help you.
Our therapy is tailored to the unique needs of each patient, with the ultimate goal of returning home.
Being in therapy, they push me to my limits and like further. They see my potential, and then they pushed me past that. I've been doing things that I wouldn't think I would have been able to do.
Our gyms feature specialized equipment for patients of all ages and sizes. Therapists incorporate age-appropriate games and activities to keep our patients engaged and motivated, which helps each patient achieve the best recovery and outcome possible. We also have a gym specifically designated for teenage patients.
As a teenager, you're still a child. And there is so much equipment and fun things. They like to play basketball. We incorporate all that into the therapy. There's other kids here. There's so many activities that you're never ever bored as a teenager here.
Unlike a facility focused on adult care, we work only with children, teens, and young adults up to age 21. We understand the physical and emotional needs of young children and teenagers who are recovering from injuries and illnesses that require the intense level of care of inpatient rehabilitation.
Everyone here is caring, definitely have their best interest in you.